In a bustling New York hospital, the constant beeping of monitors and the shuffling of nurses filled the air. Dr. Michael Carter, a seasoned emergency physician, leaned against the counter of the nurses' station, rubbing his temples after another long shift. Across from him stood Laura Hastings, a new resident doctor, her eyes wide with a mix of exhaustion and disbelief at the chaotic scene unfolding around her.
Dr. Carter, I don't understand how anyone can manage this pace. It's like we're always drowning. Is this normal?
Unfortunately, it is. Welcome to the American healthcare system. Overworked staff, underfunded hospitals, and an insurance bureaucracy that makes everything harder. You get used to it, but it doesn't get easier. What's bothering you the most right now?
Honestly, it's the insurance approvals. We've had patients waiting for critical procedures for days because we're waiting on authorization. It feels like the system isn't built to help people, just to make money. How do you deal with that?
You hit the nail on the head. It's frustrating beyond belief. I try to focus on the patients I can help directly, but it's hard when every decision is weighed down by what insurance companies will cover. Sometimes it feels like we're just patching people up and sending them back into a broken system.
Question. Dr. Carter, how do you stay motivated when the system seems so stacked against us? A. By focusing on the individual patients I can help. B. By advocating for policy changes outside of work. C. By trying to ignore the larger system and just doing the job.
Answer A. By focusing on the individual patients I can help. Laura, if I didn't focus on the patients in front of me, I'd burn out fast. The system is flawed, but the people we treat, they're the reason we're here. When you see someone walk out of this hospital alive because of something you did, that's what keeps you going.
Laura took a deep breath, reflecting on Michael's words. She glanced at the crowded where patients sat in chairs, waiting for their turn to be seen. The reality of the situation hit her harder now, but there was some comfort in knowing that she wasn't the only one grappling with the system's flaws.
I had a patient this morning, an older gentleman who couldn't afford his diabetes medication. He was so grateful just for the insulin we provided him. But it breaks my heart knowing he's going to struggle once he leaves. How do you cope with that helplessness?
It's tough. You do what you can. But there are days when it feels like we're putting a Band-Aid on a bullet wound. I try to remind myself that even small victories count. Still, the bigger issues, that's out of our hands, unless you want to go into politics.
Not sure I have the stomach for it. I'd rather be in the than a boardroom full of insurance executives. Speaking of which, do you think the healthcare system will ever get better? Or are we stuck with this mess?
I'd like to hope it'll change, but there's too much money involved. Lobbyists, pharmaceutical companies, insurance giants, they're all too powerful. Unless something drastic happens, we'll probably keep running in circles. But that doesn't mean you should stop fighting for what's right in your corner of the world.
Question: what do you think would make the biggest difference in fixing the healthcare system? A. Universal healthcare coverage. B. Reforming insurance regulations. C. Increased funding for public hospitals.
Answer A. Universal healthcare coverage. I think universal healthcare coverage would be the most impactful, option A, if everyone had access to care without worrying about whether they could afford it. We'd see fewer preventable illnesses, less strain on emergency departments, and healthier populations overall. But that's a long way off.
Michael's words left Laura thoughtful. The prospect of universal health care seemed like an obvious solution, but the road to achieving it felt impossibly long. She rubbed her tired eyes, still processing everything she'd witnessed that night.
It makes sense. It's frustrating to see people delay care because they can't afford it, and then they come to the when things have gotten so much worse. Preventative care seems like a no-brainer, but here we are.
That's the reality we're working with, and every day is a new battle. But remember, small changes can make a difference. Even in the short term, we've got to keep fighting for our patients.
I guess that's where it starts, right? Human connection. Maybe that's the only way we can survive in this system, by staying grounded in those moments.
Exactly. You won't fix healthcare overnight, Laura. But if you can help one person make one life better, then you're doing your job. Question: when it comes to dealing with the system, what do you think is the most important part of being a doctor? A. Providing the best care possible under the circumstances. B. Advocating for patients beyond just their medical needs. C. Focusing solely on the medical aspects and letting the system take care of the rest.
Answer B. Advocating for patients beyond just their medical needs. I think advocating for patients beyond just their medical needs, option B, is crucial. It's not enough to treat their physical symptoms when the system is working against them in so many other ways. We have to be their voice, push for what they need, even if it means battling with insurance or hospital policies.
That's the right mindset. It won't always be easy, but it's what the best doctors do. You'll figure it out.
As the hours stretched into early morning, the finally began to quiet down. Laura sat beside Michael, sipping from a cold cup of coffee, her thoughts racing.
Thanks for talking me through all this. It's a lot to take in, but I'm starting to see things more clearly.
Anytime, Laura. You're doing great. Just remember, this system is tough, but you're tougher.
They exchanged tired smiles as the shift wound down. Despite the chaos and frustration, there was a sense of solidarity between them, a shared understanding of what it meant to work within a flawed system, yet still find meaning in the small victories. As the first light of dawn filtered through the hospital windows, Laura felt a renewed sense of purpose. The system might be broken, but as long as there were doctors like her and Michael fighting for their patients, there was still hope for change. 5 words and phrases related to the theme of healthcare in America.
Universal healthcare, a system where everyone has access to healthcare services without financial hardship. Insurance authorization. Approval required from an insurance company before certain procedures can be carried out.
Preventative care. Medical services aimed at preventing diseases before they become serious. Lobbyists. Individuals or groups that try to influence public policy in favor of particular industries, like healthcare or insurance.
Public hospitals. Healthcare institutions funded by the government to provide care to the general public, often facing financial strain.